why some people get more sick, from COVID than others, why some people don't, get symptoms at all if they're infected. And that's a really good question. And we've kind of been challenged with that throughout time with infectious diseases. And we know that, different infections, have a different impact on people. So we do foodborne outbreaks a lot, and we have a group of people who are mostly all exposed to the same food items, but a certain percentage get sick and a certain percentage don't. We get people who have influenza each year, and some people get really sick and some people don't. A lot of it has to do with the infectious dose. That's one of the things that can play into how people are infected. So that initial, exposure, if you get exposed to someone who, has a lot of virus or is kind of transmitting a lot of virus in their sneezes or coughs or just by talking, and you are exposed with a high dose of virus, and then that could, play a role in how sick you get from that infection. Other conditions are how healthy you are as an individual. Do you have any underlying health conditions? Are you, immunocompromised and things like that? So how healthy your body is and how able it is to fight off infections. That's another role that plays into how, if someone gets sick, first of all, and how sick those people get. And so, just, nutrition and sleep and exercise, all those things play into, how healthy someone's immune system is. And sometimes those people may not know it, but their immune system might be a little weaker. And, combined with that first infectious dose, they could experience greater symptoms than others. But, without a great, specific reason for why that happens, we don't know all the time why, but those are some things that contribute to the differences in how sick people get from COVID.
So our next question is, what is the point of a third dose? Is the third dose vaccine improved to better protect against variants thus requiring a third dose? And what is the number and percent of deaths of vaccinated people compared to unvaccinated people?
Yeah, so the third dose, so I kind of want to differentiate between a third dose and a booster dose. So a third dose is provided to individuals who have a moderately or severely compromised immune system. So they may have diseases such as cancer or had a kidney transplant or taking medications that reduce their immune response. So they might not have had a great response to those first two doses of the vaccine. And so that's why those individuals are recommended for a third dose. So it doesn't mean that's a booster dose. It's just that we want to raise those people's immunity up to the same level as people who with a good immune system have with the two doses. And so that's why individuals with severely or moderately compromised immune systems are recommended for that third dose.